Years ago, when I was younger, I loved the smell of fresh baked bread. Didn't know that tiny protein would one day mess with my own head. Now my body fights inside me for a bite I used to crave. While I was home and warmth and kindness turned my God into its grave. It started soft, but it ended wild, a fairy tale that light and smiled. But now I see such a brighter way. My fairy tale can heal someday. A bite of bread, a piece of cake, a spoon of pasta seems harmless, right? But for some people, that's where the disaster begins. Hi everybody, I'm Dr. Mehrnaz, a dentist, and today we're talking about a disease that literally starts with bread and goes straight for your gut and your mouth. Celiac disease. Celiac disease is an autoimmune condition, which means your immune system gets confused and starts attacking you. Normally, when you eat, your digestive system absorbs the nutrients your body needs and gets rid of the rest. But in people with celiac disease, when they eat gluten, the immune system freaks out and attacks the inner wall of the small intestine. So, what's gluten? It's a protein that gives bread its stretchy and fluffy texture. The result of that immune attack inside your small intestine, there are these tiny hair-like structures called villi. Their job is to absorb vitamins and minerals. In celiac, the immune system destroys them. And once they're gone, your body cannot absorb essential nutrients anymore, like vitamin D, calcium, iron, folate, and B12. And that's when the real problems start: anemia, weakness, fatigue, weight loss, osteoporosis, mouth ulcers, and enamel defects. It's a genetic disease. If one of your parents or siblings has celiac, your risk jumps by about 10 to 15%. So families with celiac history, even if they don't have symptoms, you need to get tested. Here's where it gets really interesting. When your gut stops working properly, your mouth starts talking. Your teeth are usually the first to raise the alarm. Dentists have been noticing a pattern for years. Many times before celiac is ever diagnosed, its signs show up right here in your mouth. Your tooth enamel, that's your armor, your shield. But when your body cannot absorb calcium, vitamin D properly, that armor gets weak and brittle. You start seeing symmetric white, yellow, or brown spots on your teeth. Symmetric means, for example, both front teeth have the same kind of stains. That's a classic sign of celiac. And sadly, enamel damage is permanent, but your dentist can help restore your smile with composite fillings or fluoride treatments. If you're getting mouth ulcers, especially large, painful ones that take forever to heal, that could be also a sign of celiac. Why? Because your body cannot absorb iron, folate, or vitamin B12 properly. And it's important to notice that kids with undiagnosed celiac usually have delayed eruption of their permanent teeth because their bodies do not get minerals needed for proper growth. Sometimes a dentist is the very first person to suspect celiac disease. In some cases, the immune system even affects the salivary glands, causing dry mouth, which means more bad breath, cavities, and inflammation. And the inflammation isn't just in the gut. It can spread throughout your body, including your gums. Low vitamin B can cause tingling or numbness in your gums or tongue. Low iron and folate can even lead to a vitamin K deficiency, making your gums bleed easily, especially while you're brushing or after dental work. So, yes, because nutrient absorption goes down, your teeth become weak, your enamel fragile, and your gums inflamed. Now it's time to say that years ago, when I was younger, I loved the smell of fresh baked bread. Didn't know that tiny protein would one day mess with my own head. Now my body fights inside me for a bite I used to crave. While I was home and warmth and kindness turned my God into its grave. It started soft, but tale that let them smile. But now I see such a brighter way. My fairy tale can heal someday. Now the big question, what can you do about it? The only way to control celiac damage is a strict gluten-free diet. No cheating, no just one bite. So what foods should you avoid? Wheat, barley, rye, anything made with this like regular bread, biscuits, pasta, cakes, pastries, processed or canned foods containing wheat flour, sauces, gravies, and dressing thickened with gluten-containing flour, and even some toothpaste and mouthwashes can contain gluten. So make sure you're using gluten-free oral care products too. Now, what can you eat safely and what's actually good for your teeth? Fresh meats like chicken and fish, eggs, plain dairy products without additives, fresh fruits and vegetables, especially leafy greens like spinach and lettuce, citrus fruits, legumes like lentils and beans, potatoes instead of bread, nuts and seeds, almonds, walnuts, healthy oils like olive oil and avocado oil. These foods help your body get enough calcium, iron, vitamin D, and B12. Sometimes your doctor may also prescribe supplements to help replace missing nutrients. But remember, going gluten-free isn't a temporary fix. It's a lifestyle. Once you stop eating gluten, your intestine starts healing. The villi grow back. But it takes time, sometimes months, before your nutrient absorption returns to normal. And during that recovery period, your mouth tells the story first. Less sensitivity, fewer ulcers, that's your body saying, thank you, I'm healing. Now about dental care for people with celiac. Regular dental checkups to catch early signs of enamel damage or gum changes. Use fluoride toothpaste. Use a mouthwash regularly, use dental floss, drink enough water, and keep your mouth moist. Sometimes celiac disease stays silent for years. No stomach pain, no diarrhea, nothing. Just your mouth sending out tiny warnings like cracked enamel and serious stains. Those small signs could literally save your life if you listen to them. And at the end of the day, celiac isn't just about cutting out gluten. It's about listening to your body. Your body always talks, sometimes through your skin, sometimes through your gut, and very often through your mouth. Our teeth aren't just for smiling. They're how our body talks to us. So if your mouth is sending a message, please do not ignore it. Because behind a single white spot on your tooth, there could be a whole hidden story about your health waiting to be told.